Welcome back to my channel, and today we're talking about PDO threads and PDO thread lifts. Over these last few years on Instagram, PDO threads have gained popularity again. I've been seeing PDO threads for multiple different types of treatments popping up on my feed a lot. First question, what are PDO threads and what do they do? PDO threads stands for polydioxanone threads, and they're used in thread lifts. Now, there are many different kinds of threads. There are PDO threads, there are PLL threads, there are PLA threads. The difference between them is basically that they're made out of different materials, but they're all thread sutures. So what are thread sutures? That's how they stitch you up. Sutures are basically used to hold flesh together after surgery and etc. And now they're using it to lift and tighten skin. From what I understand, there are a lot of different kinds of sutures that you can use to lift your skin. PDO is one kind, and within PDO, there are different subcategories of threads. And everywhere I looked, it said that your doctor will know what is suitable for your situation. They use different threads for different things, and that's why there's so many types. Now, I have my notes here because this is a lot of information. So like I said, PDO thread lifts are used to lift and tighten the skin. What happens is the threads are introduced to deeper layers of the skin and it produces these effects: instant skin lifting, collagen stimulation, skin tightening, and improved skin texture. Now within PDO threads, there are 3 different kinds of threads, and I will put the picture up right here, right next to me. There are floating threads, non-barbed threads, and barbed threads. And there are other colloquial names for these as well, such as screw head. You'll see these Instagram doctors using those terminologies instead. Non-barbed threads offer less lift, but more collagen stimulation and contouring. So these are good for the corner of the mouth or along the eyebrow. And then barbed threads are good to gather skin together for a lifting action, and they're good to place at the hairline to pull back skin gently. And they can even be placed in your breasts or buttocks, or I've even seen on Instagram they put it in your thighs so your knees don't crepe up and stuff. Now, floating threads, I didn't find a lot of information on those. So if any of you guys are internet sleuths and you know about this, comment below. What are these floating threads? Now, what are being used for? I see them using this for everything on Instagram now. Like, they use it for the under eye area. They use it for crow's feet. They use it for cheeks. They use it for these nasal bloatio folds that I'm getting. And wrinkles around the mouth, jawline, jowls, turkey neck. So they use it for a lot of things. And of course, last but not least, eyebrows. To use it for the eyebrows to give you that snatched line look. It's like, what type of treatment can PDO threads replace? So they can replace dermal fillers, RF treatments, fractional laser treatments, and Botox. Does this procedure hurt? They'll use local anesthesia to numb you, but you have a little pain, swelling, and pulling after the procedure is over. And the procedure is typically 30 to 45 minutes. It depends what you're getting, where you're putting these threads, and what you're doing. After the procedure, you should be able to see these results immediately because the threads themselves are pulling back and supporting your skin and flesh. So it's going to be this immediate tightening effect. The immediate results are actually going to be tighter than what you're going to look like after your face settles. And it takes about a week to settle. How much does this cost? That's hard to tell because these threads are being used for so many different things. Like, it just depends what you're using them for. But I looked this up on the Man's Clinic spot. So I follow Dr. Naomi on Instagram, and it says that a full face of this costs around $3,750. Now I know what you guys are thinking. $3,750? How long is this gonna last? It says after about 6 months, the threads, the sutures completely dissolved, like are absorbed by your body. And then after those first 6 months, the effects should last another 3 to 6 months after that. Let's walk through how this procedure is performed. So before treatment, the patient's skin will be marked for insertion and direction of inserted threads, like so. Once marked, the insertion points will be thoroughly anesthetized, so they're gonna numb you. Now, multiple threads can be inserted through the same point in the skin. PDO threads are usually attached to a long cannula. Now, what is a cannula? A cannula is basically a needle, but it has a blunt tip. So the reason that that's good is because once it's in there, it doesn't keep piercing and tearing up things in there, like nerves and veins and whatnot. The cannula will be pushed through the tissue beneath the skin. When the thread has reached its predetermined point, the thread will be released and the cannula will be removed. This process will be repeated until the desired lift is achieved, with as many as 1 to 15 threads inserted depending on the treatment area and concern being addressed. Any extra threads will be trimmed. The threads will be massaged to ensure the tissue is smooth and no dimpling is present. Recovery time is minimal after PDO thread lift. Most patients are able to resume normal activity within 1 week post-operatively. Who is this procedure good for? From what I've read, this procedure is good for people who want an immediate lift, but they don't want to do a facelift. How this compares to a lift using Botox or filler, from what I've seen, this gives a more dramatic, immediate result because there are threads in there just supporting your flesh. Now, this is the part of the research that I was particularly interested in and why I got into this topic, because I wanted to know, how long have these threads been around? And where did they first come from? And is there some historical evidence that we can see what are the long-term results of this procedure? So basically, the first form of these thread lifts started in the 1990s and lost popularity around the mid-2000s. So the reason it fell out of favor is because the threads that they were using before were permanent threads. So they weren't like the dissolvable sutures that they're using now. They were permanent threads, and they had an increased chance of infection and the threads just breaking. And there were other issues, like the threads could only be pulled in one direction. I don't really know what that means. I thought that you can only really pull one thing in one direction at a time. But basically it says the threads could only be pulled in one direction, and it made the results appear very two-dimensional. So I guess basically what they're trying to say is that the results didn't look natural. It didn't look really good. So people just stopped doing it. The newer thread lifting procedure is safer with a lower risk of infection and less chance to break over time, the threads that is, and it also improves the skin quality, and the results are natural looking. And it gained popularity again in 2015 because Gwyneth Paltrow covered the older version of PDO threads, so the permanent threads. She covered that in a story for Goop. So what she called it was an under the radar approach to aging, to fight aging, even though the one she was recommending wasn't completely safe at the time. But now, due to new research and advancements, the FDA approved dissolvable threads, and PDO lifting is having a huge comeback. So within the last 3 to 5 years is when this comeback has been going on. Okay guys, so I'm looking back through my video and I forgot to mention that a lot of people call these Korean threads, and some of these threads are made in South Korea, and this procedure gained popularity in Korea first, because I just want to shout out Korea, because I feel like a lot of times things don't pick up in the mainstream unless they pick up in the mainstream in the US. But in reality, these things have probably been going on in a long time in other countries. Just wanted to add that in there. Sorry for my unprofessional ass. So what do I think of this treatment? Oh, okay. So needles freak me out. And these needles, some of them are looking long and big. I'll insert some pictures here. So personally, I don't think I would get this treatment. I've never had any cosmetic procedures done, but I'm obviously not against them. And if I were to get something done, the first thing I would do is Botox. So this whole PDO thread thing, it's only gained popularity again in the most recent 5 years. So I feel like I'm a little wary of it. So the first treatment I'm going to talk about is just the overall lifting treatment. And honestly, from what I've seen on Instagram, the results look amazing. And it's a great procedure in the sense that it's not that invasive. You don't have to commit to a full facelift. So you can kind of see like what you would look like if you got a facelift. Honestly, I think the PDO thread lift for cat eye looks so good. Like, I've seen so many before and afters, and in my opinion, the girls just look so much more snatched and younger after the procedure. And it's already young girls who are like doing this procedure. I've seen like, 20 really to mid-20s maybe, and you saw Bella Hadid and Kendall Jenner rocking this real snatched cat eye look, and this procedure for that particular area has been gaining such momentum. And I mean, I don't know if that's how Bella and Kendall achieve that cat eye look, or if it's just makeup or whatever they're doing. I've seen some Instagrams suggest that that is part of their regimen to maintain that like almost otherworldly type look. Now, so what are the downsides of these PDO threads? So first of all, they don't last very long. So they're saying that in total it can last up to like a year. Long term, the collagen stimulation is supposed to last a little bit longer. The whole cat eye that drops down pretty fast, because after 6 months the threads dissolve off, and it's probably still gonna look a little tighter than it was before. The whole mechanical pulling of the threads, like, that will be gone once they dissolve. So do I think it's worth it? Maybe not. I personally wouldn't do it, but you can't argue with the results. They looked really, really snatched, and I like it. I'm not gonna lie. Are there gonna be scars from this treatment? So there are entry holes from the cannula needles that they put in your face. There could be some scarring at those entry holes, but many people say that they're not really visible. But I know that I scar really easily. A cut that deep, that would probably keloid for me. And what are the dangers? Like, how could this really go wrong? Of course, the bruising and swelling and bleeding that happen right after the procedure. There's a potential for surface depression, facial asymmetry. I already got that. Protrusion of the threads, which is resolved by cutting them back, prolonged pain or dimpling, infection, migration of the threads, damage to blood vessels, and facial nerve damage resulting in facial paralysis. So these are like the worst things that could happen that I found on the internet. Everyone's saying, and all these articles are saying, that these cases are really, really rare, but I'm not seeing a hard number percentage. Maybe we need more information, like this procedure needs to be going on for a longer time until people like me are more comfortable with it and willing to go do it. But that's just me. A lot of people are doing it. Okay, so that's it. That was my quick rundown on what the heck these PDO threads are, and like, what is this thing that we're seeing like so much on Instagram, and like just kind of. Okay, so that's basically it. That's what I've learned from my research about PDO threads, and I hope you learned something too. If you want to hear more from me, just subscribe to my channel. Like this video, dislike this video, leave a positive comment, leave a negative comment. Just let me know what you think. Bye now.